Contrast-enhanced imaging is a pillar of diagnostics, but how it's supervised is undergoing a radical shift. Healthcare faces a persistent shortfall of radiologists, an imbalance projected to continue for decades. What if you could address this shortage while cutting your operational costs by up to 30%? This isn't just about savings, it's about greatly expanding patient access for underserved communities. This is the promise of virtual contrast supervision. We will break down how to achieve it safely and compliantly. First, understand this is not a temporary workaround. The Centers for Medicare and Medicaid Services has given its approval. Effective January 1 of 2026, CMS permanently authorized virtual supervision, validating real-time audio and video technology. With this official green light, we have a powerful tool to combat the persistent radiologist shortage. This is about sustainability. By offering flexible work and eliminating commutes, it directly addresses radiologist burnout. So the need is clear and the federal approval is in place. This leads to the most important question of all. Is it safe? To understand safety, we must first understand the risk. Adverse reactions to contrast media are rare, occurring in less than 1% of cases. The risk, while low, is real. Conventional wisdom says an on-site radiologist is the only safe option. But what if that's wrong? The surprising truth is that virtual supervision, when done correctly, can actually improve patient safety. But how is that possible? First, a remote radiologist's attention is undivided. They aren't pulled into other duties. Their sole focus is the procedure. Second, these platforms enforce standardized protocols. Every patient check and alert follows a consistent, best practice workflow. Third, it creates a two-pronged response. A highly trained on-site technologist supported by an immediate, remote clinical expert. The data confirms this works. An RBMA survey found 30% of centers had faster response times with virtual supervision. Critically, the same study reported no negative impacts on patient care, showing a model that is equivalent or even superior. So, we have a federally approved method that is safe and effective, but there's a huge catch. Getting the technology wrong is catastrophic. Welcome to the world of HIPAA and the HITECH Act, where penalties for data breaches can reach $1.5 million per year. Radiology departments are prime targets. A single unsecured file transfer can compromise thousands of patient records. The biggest mistake? Using off-the-shelf tools. Standard Zoom or FaceTime are not HIPAA compliant for this purpose. Any third-party vendor handling patient data must be a compliant business associate. Without a signed BAA, you assume their liability. And it's not just federal law. State-specific rules, like those in California, add another layer of complexity. One size does not fit all. The regulatory and security risks are daunting. So how do you bridge the gap between the opportunity and the severe penalties? We asked how virtual supervision could be safer. The answer is a purpose-built secure platform, a clinical tool, not just video chat. These platforms are built to solve the HIPAA pitfalls. They have end-to-end encryption, access controls, and are offered with a BAA. They integrate safety and compliance. Features like instant emergency alerts and automated documentation ensure best practices are always followed. This is the key. A compliant platform is the engine that enables cost savings, expanded access, and the work-life balance that retains radiologists. The future of contrast supervision is here. It is virtual, efficient, and safe. This transition is a strategic imperative for any modern practice. Success hinges on two components: a purpose-built, secure platform that guarantees compliance, and a commitment to training your technologists. The risks of non-compliance are immense, but the rewards of a well-implemented program are transformative, improving care and lowering costs. For hospital administrators, radiologists, and compliance officers, the time to evaluate these solutions is now. Do not let fear halt safe progress. Choose a secure, compliant platform and turn the biggest challenges in radiology today into your greatest operational advantages. Learn more about secure virtual contrast supervision platforms and how to implement them in your practice.